big changes this week when it comes to COVID-19 measures. Starting tomorrow, the province is lifting capacity limits in all indoor public settings and is scrapping vaccine mandates at restaurants and gyms. This comes one day after public health measures are being eased for fully vaxxed travelers coming into Canada. So for more on this, we're joined live tonight by Niagara's Acting Medical Officer of Health, Dr. Mustafa Hirji. And we also welcome back to CP24 Tonight, Dr. Peter Uni, Director of the Ontario COVID-19 Science Advisory Table, and Dr. Abdu Sharkawi, Infectious Disease Specialist with the University Health Network. Thanks to all of you. Dr. Uni, how comfortable should we be, working out or dining out, not knowing the vaccination status of the people around us?
Oh, I think it's just important once more just to take aboard that the vaccine protection against infection for somebody with 2 doses who hasn't had an infection recently and somebody without the vaccine is about the same. The difference between these two people, one vaccinated with 2 doses and one without, is the risk of ending up in the hospital in an ICU. That's different. But, from this perspective, this is more about just how comfortable really just the clients feel just in the face of something they got accustomed to, but it won't make much of a difference transmission-wise. We couldn't do a 3-dose vaccine certificate, and therefore it's completely okay to lift it now. It would have been too challenging for pragmatic reasons to do a 3-dose certificate.
Okay, so Dr. Sharkawi, if you're immunocompromised, though, would you be going to restaurants, to concerts, to sports games? Do the rules and the guidance sort of change if you're higher risk?
Well, I think certainly you have to take pause if you are of a higher risk category, simply because although Dr. Juni is correct that there is certainly a significant reduction in transmission, even at 2 doses, there's a big difference between 3 doses. And there's also a big difference in terms of maintaining other public health measures like masking, etc. I've seen more than my share of colleagues, their families, and close friends who've had 3 vaccines, and they have had breakthrough infections. And I would be concerned about the possibility of transmitting an infection, even from somebody relatively healthy, to someone else who's immune compromised. So I understand the complexity of a 3-dose vaccine passport. I don't know that it's necessary. I just wonder about the timing of lifting these restrictions right now when we're still very much in the throes of a cold Canadian winter, and we have very little to go on in terms of indicators of the amount of circulating virus right now besides wastewater signal. And frankly, that has plateaued since about the middle of February. So we're not going to be relying on the metrics of hospitalizations and ICU admissions at this point to tell us how much disease activity there is in our community, because we simply don't know otherwise.
Okay, so even though the province is lifting this mandate, want to point out that individual businesses still have the right to require proof of vaccination, and there are some businesses that are exercising that right. I want to point to London's Acting Medical Officer of Health, Dr. Alex Summers. He said he strongly supports the ongoing use of proof of vaccination policies in some settings. So, Dr. Hirji, what's your reaction to this? Is this something you would support as well?
Yeah, absolutely. I'm on the same page as Alex Summers that the proof of vaccination requirement remains something useful for us to have going forward. I think Dr. Uni's correct that with 2 doses, it is much less value. Now, in the first few weeks after your 2 doses, you do have quite good protection from getting infected, but it does fall after that. And so I do think that we should do the hard work of bringing in a 3-dose vaccination requirement. Yes, it is a little bit more difficult, but we're dealing with a very difficult pandemic here, and I think it's worth the effort. And I hope the government decides that they will incorporate that 3rd dose into the vaccine QR code so that businesses who are making that responsible choice to protect their customers, protect their employees with proof of vaccination, really get the best available protection with the full 3 doses.
So, Dr. Uni, what's your response to that, a call for a 3-dose vaccine mandate?
Well, I think we need to be aware of that. We might need it again. That's the point. I'd rather prefer to lift the 2-dose certificate right now, but be ready, because the pandemic won't be over, to reintroduce one that actually works when it's needed. We hope, that this will become seasonal this year, but we don't know yet. And there will be another wave of infection sooner or later. And that's the moment where we would need the possibility to update our vaccine status, all of us, perhaps with a booster. And then we might need to reintroduce certificates. And then I would completely be in favor of that. And, to address some of the other aspects, I also completely agree. If you are, immunocompromised right now, Omicron is not over. We're still in this wave and we need to be careful. So if you are in a situation like that, I just wouldn't advise to do indoor dining, to be very frank.
But Dr. Juni, is that a bit confusing to say that you feel confident in this decision to lift the mandates at this point in time, but very soon we could go back?
No, it's not. The point really is, it can be confusing, but I think it's consistent. The point really is, right now we're at the point where we have built up quite a lot of immunity and we have to make a difficult choice. Either we try to reintroduce now a definition that actually works, that's 3 doses or 2 doses and a recent infection, and we can't diagnose infections, or we say, okay, for the time being we lift it because it's more of a placebo right now to have it, but we're ready to reintroduce when we have a next wave. I really hope that we will now just do the rest of, loosening restrictions stepwisely, driven by data. The wastewater analyses work really quite well right now. And we see, as was pointed out already, we plateaued. Some places are bumpy, like the north, and we just need to be aware of that we're not out of the wave. We will probably have a good late spring, hopefully a good summer, but things might bounce back and we need to be ready for that. And I'd rather have then the vaccine certificate in the back of my pocket again and be able to say, okay, we're sorry, but we need it again because we need to moderate the wave that is coming.
Okay, so I'm thinking back to March 2020 when the Premier had said just before March break to go, have a good time, enjoy your vacation, come back, we will deal with COVID-19. And here we are 2 years later, heading into this March break with PCR tests scrapped for incoming travelers. So Dr. Sharkawi, is this the right time to loosen rules about travel?
I think travel is a bit of a difficult one simply because I don't know that we've had a very clear understanding of being able to prevent community transmission through any of the mechanisms that have been used for people coming into Canada, whether it's been through the quarantining, the hotel experiment that really didn't go over very well, and all sorts of inconsistencies in terms of follow-up. And frankly, the difference between having 2 doses and having 3 doses with respect to PCR testing, probability is probably not going to make a big enough difference in terms of community transmission. So I think this is probably a reasonable thing to do. I do worry about lifting other restrictions within our own native domestic community here, irrespective of travel. I think that is going to be potentially problematic. And I agree with Dr. Juni, we want to have something in our back pocket. The trouble is, I think that lends itself more to a reactive approach. I would rather we do as much as we can to optimize more vaccine uptake right now, not necessarily get rid of a mask mandate in schools and other places, and try and hold off a little bit more until we get to that spring and when we allow a safer environment for people to gather outdoors for more things, as opposed to going the other way around.
And the Premier indicating we could be just weeks away from lifting the mask mandate, as you mentioned, Dr. Sharkawi. So, Dr. Hirji, how comfortable are you with that idea of eliminating masks in indoor settings in just a few weeks, potentially?
Yeah, I'm extremely uncomfortable with that prospect. And I agree with Dr. Sharkawi that we need to be very careful about lifting things right now. When we look at what we're seeing with COVID-19, because we can't test everybody with PCR right now, we don't have a great sense of the true number of cases. But likely the number of infections right now is higher than it's been at the peak of any of our previous waves. So there's still a lot of infection going around. There's quite substantial risk out there. And I think we need to be very careful going forward here. I think taking away masks, which really don't impede economic activity, is, I think, a very bad decision at this point. We should hold on to that as a protection as much as possible going forward. I think for those businesses who want to have proof of vaccination requirements, let's do the work of updating that requirement so that the QR code does recognize the 3 doses, so that if they're voluntarily choosing to have that rule in place, it aligns with the best science. And then we'll have it there, as Dr. Uni says, in our back pocket if we ever need to mandate it further. And I think we need to, of course, continue to encourage everybody to really make sensible, careful choices going forward. Not to see that the opening up tomorrow is that everything is back to normal, the pandemic is over, but rather that we are taking a step of really putting the onus on everybody as individuals and businesses to do the work of trying to control COVID-19 going forward by making careful decisions by ourselves, by avoiding really crowded spaces, by being diligent about wearing our masks, and making sure we're up to date with our vaccinations with those first 2 doses and that booster dose.
Okay, a very interesting conversation. Thanks to all of you, Dr. Abdu Sharkawi, Dr. Peter Uni, and Dr. Mustafa Hirji. Thank you again.